Hello again. HIV, AIDS, TB and malaria continue to plague the African continent. And now the private sector is stepping in to help. Anglo American is pledging $15 million to the Global Fund's 7th replenishment. The fund invests in programs to fight epidemics and end health inequality. Well, what does this contribution actually mean for us here in South Africa? Let's discuss this now with Alexandra Plowright from Anglo American. Ms. Plowright, good afternoon. Welcome to today on eNCA. Thank you very much for your time. It's a very handsome kind of money, a handsome sum that has been given for this global fund. Why now?
Thank you, Dan. So now is the optimum time for the private sector to really step up. Although not a silver bullet per se, there's a real role that the private sector can play in terms of being catalytic in supporting countries to achieve their aims associated with the improvement of systems. As we move beyond COVID, we're looking at resilience and preparedness for the next pandemic. And in South Africa, this obviously means, as you said, working to support SANEC and the national program in terms of HIV, AIDS and tuberculosis particularly, and how the programs can be accelerated and improved.
Yeah, so your contribution to this global fund, do you as Anglo American have got a say to say exactly what purpose must it be used for? Or it just goes into this bigger pot and somebody else decides?
So actually, the $15 million is going into the Global Fund's Digital Health Impact Accelerator, which is a really fantastic opportunity because it's about pushing the digital agenda together with other private sector partners across the continent. Technology, as I'm sure everybody knows, is a game changer and can really support and facilitate strengthening of systems. Things like electronic patient records are absolutely vital in terms of the continuity of care, in terms of improving the experience of patients, particularly as they move from one place to another. And, you know, this kind of fund, which brings together the skills, the expertise, and also the finances from private sector companies like Anglo American, is something that can really catalyze the outcomes that people experience in terms of their health.
Are you hoping, therefore, that your contribution to this fund, that will be focused on this technological accelerator fund? What do you call it? Global Fund's Digital Health Impact Accelerator Catalytic Fund. It's a mouthful, but anyway, what will be the benefits be? What lessons are you hoping you'll be able to get for the healthcare system in South Africa?
So we're really hoping that what this can do is to bring learnings from other industries, to give the opportunity whereby funding can actually be allocated and designated to things such as improving supply chain processes, such as digital and electronic patient records, strengthening the systems, making connectivity available to healthcare facilities. All of those kinds of initiatives, which are what is lacking across the African continent at the moment, and particularly in terms of the South African context and Southern Africa. The Digital Health Impact Accelerator is actually being defined at the moment, and over the next year, the content and the granularity of detail will come through, but it will be to the benefit of East Africa and Southern Africa as well. And we're really hoping that we can bring some of these benefits home through our footprint as a large corporate, and through our own corporate commitment in terms of our sustainable mining plan, which is really about promoting and supporting thriving communities in the areas and countries where we have operations, and using this investment together through partnership and collaborative regional development in order to support and promote the strengthening of systems so that they can improve outcomes for patients across the country.
So it's not just for South Africa. You've mentioned that where you have mining operations, you hope this technological exploration will also benefit them.
Absolutely. So a key part of this fund, and together with other partners such as Novartis Foundation and also Genesis, is about sharing expertise and knowledge and creating digital health hubs of knowledge so that information can be shared and other countries can benefit. We know through the priorities associated with collaborative regional development that this pertains directly to the success of health systems. You can't work in partnership with a Department of Health or a Ministry of Health in one area, in one country, because of the level of movement between different countries and the flow of people. So taking this approach in terms of regional development and knowledge sharing hubs, tapping into other private sector expertise and working in partnership with ministries would really do so much good in terms of supporting the development and strengthening of the health system across the regions in Africa.
Thank you very much for your time this afternoon, Dr. Alexandra Plowright. I understand you are the lead for Community Health and Wellbeing at Anglo American. All the best. Well done. Hopefully there'll be more to be put into the healthcare systems from where that $15 million came from in the future. Thank you very much for your time. Now, it might be